Hey guys, this is Dr. Daigneault. Today I want to give you a little tidbit of information about vitamin D, which is a hot topic. Well, it's been a hot topic for many years. There's good reason for that because lots of research on vitamin D, how it's affecting the immune system, how it's good for, bone strength if you don't have enough vitamin D. Vitamin D because we're sitting in an office. I grew up on the farm, right? I'm a farm boy, but for the past 25 years I've been in an office, so I don't get much sun anymore. Right? And most people out there, probably including you, is people do not get much sun. So in our town right now, I don't know where you're watching this, but in our town in Lansing, we have some pilot that comes in, and I was talking to one of them, at some point in time not long ago, and he was telling me that Lansing is considered to be the second overcast city in the country after Seattle. So wow. So what that means is, the amount of sun that we're getting is probably less than anywhere else in the country. But, right, according to research, just about everybody in the United States, they're low in vitamin D, that we don't have enough, we don't get enough. So what's the solution for that, right? For most people, I'm not saying for all the people, but I would say for most people, in the 90+%, right, people probably need some extra vitamin D, and they need to take it from the outside in. And what that means is if you were to take it from the outside in, what would you be looking for? Right? There's different types of vitamin D, and that's what I would like to educate you a little bit on today. If you have some vitamin D at home, right? Sometimes people bring their vitamin D, and you should be careful about when you buy vitamin D. It's like under the other ingredient, if there's 20 different names and you don't know what they are, those are just fillers, right? And most likely you should not be taking that. So vitamin D is pretty inexpensive, right? All of you, I bet that you can afford to take some quality vitamin D with no problem, right? Without breaking the bank. But you want to make sure that you're taking quality vitamin D, and if there's 19 different names under other ingredient, it's probably not for you, right? So you want to be taking quality vitamin D, so that's number one. Vitamin D in nature comes from the sun, right? And then there's some naturally occurring vitamin D that you also find in if you're taking cod liver oil, right? You would have some naturally occurring vitamin D. But in nature, there's not many places that you can get, naturally occurring vitamin D besides the sun. And if there's no sun around, that's difficult, for you to get what you need. So this being said, in the world of vitamin D, right, you can take vitamin D in tablets. You can also take vitamin D in liquid. So lots of you might be taking vitamin D. And then there's also some vitamin D that is not just vitamin D. Oftentimes vitamin D might be coming in with a little bit of calcium. And you also have some, these days, vitamin D will also come in with vitamin K, right? So again, sometimes you will be, what you're gonna be paying for vitamin D if you think you're buying vitamin D might be depending on, are you just buying vitamin D or it's also combined with other things. So this might have an effect on, the price, the investment that you're making when you're buying that. How much vitamin D should you have? You know what? There's a lot of conflicting information. Usually when a person comes to the office, I would test them and find out, what's best for their body. However, if you are an adult, right, it's probably either male or female, somewhere in the neighborhood between 2,000 and 5,000 IUs per day. Right? Anywhere between 2,000 and 5,000 IUs per day. Can people benefit from more? I'm sure they could if they're really low in vitamin D, right? Now remember, 1,25-dihydroxycholecalciferol, right, which is the active part of vitamin D, it's being activated into the kidneys. So you have, you have vitamin, D1, D2, and D3, and then the activation of vitamin D happens into your kidneys. So this being said, right, if you have some issues with your liver or some issues with your kidneys, if you're also people that are overweight, they have the tendency to store their vitamin D into the fat cells. All of those things can affect vitamin D level. So I just want to bring you an awareness of, about this vitamin D, what it does. There's high benefit, again, for the immune system. There's also benefit for the musculoskeletal system. There's benefit for bone strength. There's lots of benefit from different things. Matter of fact, just in the time that we're in right now with COVID-19, there's research article that shows that when people have high level vitamin D, it's protective to the lungs. So guess what, right? having enough vitamin D in your body, there's just like, you're not going to lose. That's the bottom line. There's also one thing that I want to make you aware of, which most people might not be aware of, because they have just changed the labeling on vitamin D. So on some of the vitamin D now, it says microgram versus international IUs. So for instance, in this particular vitamin D here, you have both. It says that for every 1 drop, there is 25 microgram, which is 1,000 IUs. So 25 microgram equal 1,000 IUs. So if you want to take 5,000 IUs, you'd have to take 5 drops of this, put it on the back of your hands, you lick that, 5 drops, and then 5 times 25, right, would be 125 micrograms. In some of the other vitamin D, they haven't changed the label yet, so you only have it into international IUs, right, international units. And so just for you to be aware, like in this particular Cataplex D, this is in tablets. For every 2 tablets you get, right, here it says you get 40 micrograms. So for every 1 tablet, it's 800 international unit. So I know it's confusing a little bit, but some of you, if you start looking at label and you're like, I don't know how much to take, right? I don't know how much to take. Well, you know, obviously, fortunately at our office, I can tell a person exactly what their body's calling for. But if you start taking some vitamin D, you should make sure that, number one, you're taking enough. And also, if you're giving it to your children, which they should take vitamin D as well, right? This is based on their body weight. So if a person is, you know, let's say 150 pounds, if you're an adult, and then if you have a young child half the weight, then they would take half the amount, right? So this being said, hopefully this was helpful to learn about vitamin D and how important that is. This is also part of Nutrition Basic for Dr. Jungie. As far as I'm concerned, you know, people should benefit from taking vitamin D on a daily basis forever and ever, right? As long as you're going to be that, we're not going to get as much sun as we should on a day-to-day basis, especially if you live in my area or if you work in an office, you don't go out enough, right? That's probably something that you can benefit from taking every day. So hopefully this was helpful, and we'll talk to you soon about other hot topics that you need to know to continue on this journey for better health. Take care.